Hi everyone, welcome to Jaais Knowledge. If you like this video, please like, share, comment and subscribe. Press bell icon for future notifications. In this video, we are going to talk about an important topic, toilet training for children with special needs. Toilet training. Toilet training can be challenging for parents and children. It is not easy and very time consuming. Parents often find that toilet training their child can be a frustrating process. If a child has special needs, it can be even more difficult. Toilet training can often be stressful even for children without special needs, but for every child, it's an important milestone. Toilet training increases the child's self esteem and independence, especially as they enter school or daycare. What are the ages and stages of toilet training? Toilet training can be stressful time for parents and children. Some children take to training easily, whereas others have much more difficulty. Some are ready to tackle toilet training at 3 to 4 years old and others not until they are much older. The issue of when and how to begin toilet training can be particularly challenging for parents with special needs. It is more important to keep the child's developmental level and not his chronological age in mind to start toilet training. To succeed the toilet training, they have to be physically and mentally ready. There are a number of stages a child will go through while developing bladder and bowel control. Stage 1, the child becomes aware of having a wet or dirty nappy or clothing. Stage 2, the child recognizes when they are doing a wee or a poo. Stage 3, the child can tell you in advance that they need to go to toilet. This can be done through words or actions. Stage 4, the child gains more control of their bladder and can hold on for a while. Parents can recognize a child's readiness when the child stays dry for a few hours between urinating. Let the parent know when he has a dirty diaper or a cloth and the child is interested in imitating grown-up activities such as wearing underwear or sitting on the toilet. While it may take some time and require a lot of patience, many children with special needs can be toilet trained by the age of 3 to 5 years. What are the causes for difficult toilet training? Some causes for developing a resistance to potty training are the child being scared to sit on the potty chair. Flushing the toilet may have scared the child from wanting to sit on the toilet. Being pushed too early or fast before the child was ready. Severe punishment for not using the potty or being forced to sit on the potty. Inconsistent training, especially from different caregivers. The child may have had a painful bowel movement from being constipated. If this is the case, treat the constipation and wait until the child is having regular soft bowel movements before you begin training again. The child may just be stubborn and is involved in power struggle with the parents and is using his control where he has bowel movement. The child may enjoy the negative attention he or she gets from not using the potty or from having accidents. Although rare, there are medical conditions that can make it difficult for the child to hold in or delay urinating or having a bowel movement. Disabilities and toilet training. Children with disabilities such as physical, intellectual, and learning disabilities are often slower to achieve control over their bladder and bowel. The reasons vary depending upon the child and the disability. Generally, children with physical disabilities may have difficulty in recognizing the sensation of need to go to the toilet. They may have difficulty in performing toilet tasks such as getting to the toilet, removing clothing, and sitting on the toilet. They may have difficulty in telling carers that they need to go to the toilet. They may have difficulty in learning skills involved in toileting, especially if intellectual learning difficulties are also present. Levels of toilet training. Many children with disabilities are able to be fully toilet trained. However, there are some that they will not be trained. Some children may be partly toilet trained, where they are placed on the toilet at regular intervals with only occasional accidents. Different children have different abilities and needs. Therefore, it is important to tailor toilet training around child's individual abilities. Preparing for toilet training. The first step is to find a suitable potty or toilet support. In order to let go on the toilet, it is important that the children feel safe while sitting on the potty and comfortable that seating supports their bottom, back, and feet to let go to do a wee or coordinate the pushing movement to do a poo. If the child doesn't cooperate, we can allow the child to sit out. There are some modifications of the toilet if possible. A potty that is low to the ground so that the child's feet touch the floor. A regular toilet with a step, rail, or seat belt helps the child to feel secure. Special supportive and elevated seating makes it easier for parents with lifting the child. Talking about toilet is one of the important steps for toilet training. It is important to talk with the child about body parts and what the body is doing. Some examples, if you see the child straining when wearing their nappy, you may say, "You are doing a poo." If the child does a wee in the bath or while being changed, you may say, "You are doing a wee." These things help children learn the language of the toileting and be more aware of their bodily functions. Tips to help children get used to sitting on the toilet. Introduce toilet or potty you are going to use and encourage them to practice sitting on it. Don't force this, as we want toileting to be a pleasurable experience, not a form of punishment. Use a teddy or a doll as a role model sitting on the potty or toilet. It is important that you reward the doll for successfully using the potty. Aim for small goals first. The first few times the child sits on the potty, aim to just get them to stay there for about a minute. Gradually increase the time spent on the potty to up to 5 minutes. Use distractions to help the child relax and remain seated. For example, a book, a favorite toy, sing a song. Try placing the potty in the play area so the child can go to it whenever they like. Practice sitting on the potty at a regular time, such as before bath time or after each meal. If your child successfully uses the potty or toilet, praise them. Establish a reward or incentive for using the potty. Have the child be involved in changing himself when he wets or soils himself. Make the child put the soiled cloth in the bucket meant for washing. Most importantly, avoid physical punishment for not using the toilet, even in an older child. Many children resist sitting on the toilet or potty as it is different. They often won't sit long enough for any accidents to happen. So don't get stressed out about toileting. Chances are that they will do. What are the routines and communication tips? Use the toilet consistently rather than expecting your child to use the toilet one day and outside the next. Introduce the names you will use to describe toileting behavior, for example, wee or poo, and ensure that everyone involved in your child's toilet training uses these words. Be sure to reward any attempts to use the potty or toilet and make a big fuss when the child is successful. Is your child ready to begin toilet training? Children with special needs may not show clear signs of readiness, and it can be difficult to know where to begin. It can also be very difficult to incorporate toilet training into a busy family schedule. The child's readiness to toilet train is related to his or her level of growth and development, and it is organized according to motor skills, cognitive skills, language development skills, as well as toileting skills. According to motor skills, the child can sit with or without support. The child attempts to squat without losing his or her balance. The child is walking without help. The child is able to help dress and undress his or herself. According to cognitive skills, the child searches for his or her toy. The child imitates parents or others. The child plays make-believe. The child is able to sit down and play quietly for about 5 minutes. According to language skills, the child understands simple requests like, "Where is mommy?" The child is able to show his or her needs using words, signs, or gestures. The child has a name for urine and bowel movements. The child tells about his urge for going to toilet to parents. According to toileting skills, the child is able to stay dry for at least an hour. The child is aware of what a potty or toilet is for. The child is aware of being wet or soiled. How to deal with the accidents while toilet training. Even if the child is fully toilet trained, accidents often happen. Accidents may occur when your child is excited, fearful, absorbed in play, or awakened from a bad dream. They may also occur if there is any change in home routines like the birth of the sibling, a move, or starting school. When the child is sick, expect accidents until he or she is better. Don't punish child if an accident occurs. Some children get upset over their accidents and frustrated with toilet training. Now we'll see a practical model which was succeeded by parents of an autistic boy who was in complete diaper for urinating and bowel movement when he was 3.5 years old. Once the parents started toilet training schedule, they had succeeded within 3 months and removed the diaper completely. The boy became totally independent in toileting behaviors. We will see the practical model elaborately in 7 stages. Stage 1. Parents should make a chart of usual routine timing of pee or poo of the child and should mark on the chart as soon as the child makes. Once the chart is ready, the parents can move to stage 2. In this stage, the main aim is to remove the fear of commode. So, parents should make the child to sit on the commode with diaper at least thrice a day at any time. Once the stage 2 completed only, the parent should move to stage 3. In this stage, the parent should make the child to sit on the commode with diaper as per toilet chart timing. In this stage 4, the parent should make the child to sit on the commode with diaper whenever the child showed an urge to go to the toilet. This stage is really a milestone for parents as the child became comfortable to make pee or poo in commode with diaper without any fear. In this stage of 6, whenever the child strains for pee or poo, The parent should cut the bottom of the diaper immediately and make the child to sit on the commode with upper diaper portion which is attached on the hip of the child. This is the stage 7 of removing diaper completely. Once the child used with this type of practice, parents should gradually remove the upper portion of the diaper which is attached with hip of the child. Finally, the child got used on this practice. Toilet training does not happen in an instant. It takes a lot of practice and patience. It won't be easy and there will be a lot of accidents along the way. But learning to use the toilet is a worthwhile developmental opportunity for the child with special needs that should not be delayed. When toilet training is fun and relaxed, children are more likely to learn more quickly and be proud of their achievement. Overall, stay calm and positive while toilet training. Good luck for the toilet training and remember that this is an adventure for both parent and child, but the reward sure is worth it. Thank you.